I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we have the agenda in front of us. Is there any additions or corrections to that? If not, is there a motion moved to approve?
Second.
Motion been made and seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Approve the previous minutes from board meeting of September 16th. Any additions or corrections to those?
I think I saw it somewhere. Was this the meeting where the representatives from La Crescent were at?
That was 2 meetings ago.
I'm looking for, there was something with a name. Okay.
No,
Yeah, that
this
was
is,
probably on
that
that.
was from that was a
That
while
was
ago.
previous,
Yep.
okay. I was just gonna add a name to that. That's fine.
Okay,
I'm good with these. I'd motion to approve.
there's a second.
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Public comment. Now is a chance for anybody who'd like to come forward and make a public comment. Okay. Seeing as how we don't have any in public comment, are we ready to go with appointments? We can do the Southern Minnesota Regional Medical Examiner's Office. Report.
Yes.
Good morning.
Morning. Thank you. Mr. Chairman, fellow commissioners, I appreciate you having me here today.
Thank you.
So my name is Dr. Ross Reichert, and I'm the medical examiner for Houston County and the chief medical examiner for the Southern Minnesota Regional Medical Examiner's Office, and I'm here to give the annual report for Houston County. So I will say in previewing this and going through the data in preparation, I've decided that I want to move to Houston County.
You say that every year, but
I do say it every year. I gotta get my. If you had a competitive swim team for my son, then it would be. It would definitely be.
well, I don't think we got that.
I know. So yeah, I do say it every year, but gosh. Anyhow. All right. So just as a reminder of our jurisdictional area, so the pale blue are the counties that we provide the full medical examiner services for, and the purple counties are the ones in which we do consult autopsies for and support their death investigation system. So it gives us a pretty good feel of what's going on in the region, and we'll kind of show that today. This is our core staff. I'm joined here today by Monica Kendall, who's our death investigator supervisor. We now have actually not just 4 forensic pathologists, we had a 5th one that just started, so we've grown our number of staff. We have our central office death investigators, which are the middle line there, and they're all pathologist assistants, which really puts us in a different category of level of expertise. And then I can't say enough about Bob Cooper and Mike Pollinger, who are our frontline death investigators that are really answering the calls 24/7. 365, and really the ones, keeping things moving. And they've done this for a long time and are great for us to work with. And so Houston County is lucky to have them in those roles.
We are.
Yeah, so. So just as a brief reminder of death certificate, we have the cause of death, the underlying reason why someone died, the manner of death, which is the circumstances, and then a lot of other information that's not on the death certificate that the family receives, but is captured for purposes of public health and data collection. And so, who are the death certificates used by? Obviously, the family for closure to try to understand what happened to their loved one, and obviously some legal and other financial things. But then also that death investigation information on the death certificate rolls up to the state, which the health department, and then ultimately to the CDC. And so when you see the numbers of number of drug overdose deaths or motor vehicle accidents, et cetera, I mean, it really starts at the grassroots level and eventually crescendo. So, it's a neat way that it's connected, and obviously can be a big driver of resources in different areas that are that need it for particular issues. So this is just a high-level summary of our involvement. There were 144 deaths. 139 were reported to the medical examiner, which from our standpoint, it's great. We'd rather have more deaths reported to us and then be able to say this isn't something that we need to be further involved in, than find out later that there's something that like, hey, did you know about this kind of thing? And it's hard to kind of go back at that time. We did 10 autopsies, and we did sign the death certificates without an autopsy on 9 cases. And this is a category in which we're seeing it kind of grow a little bit. And so this is where we can document injury that contributed or caused a death, and that makes it under our jurisdiction, but it's very well documented. And the circumstances in which this is coming is even more in the external examination is, individuals are on hospice, for example. They have a fall, it looks like they've injured themselves, but they're not going to do anything at that point. And then we end up basically evaluating them and seeing, do they have a fracture? Do they have bleeding on their brain, a subdural hemorrhage that would contribute? And obviously that's a big difference in the manner of death, and obviously the ramifications of having a fall that contributes to death versus not having an injury makes a difference. But we're kind of seeing a generalized increase in that. And so in one way, shape, or another, 97% of the deaths pass through in some way through our office. And so that's, we also review and are aware of hospice deaths too. And so those also come through us, as well as cremation permits and other things. So we're touching a high number, which I think is good because it allows us to do this for a living, to have our eyes on what's going on. So manner of death, so again, the circumstances, the vast majority of deaths were natural. There were no suicides, no homicides, and there were 9 accidents. And we'll dive into this in more detail.
That's a good report.
We could just stop right there almost.
No suicides and no homicides, I like that.
I mean, and I'll just go ahead and spoil it for you, but there's like no drug overdoses either. I mean, you have no idea, and I know I've said this before, like how unique that makes this county to not have those. I mean, it really is a defining feature. And I tell my fellow medical examiners about Houston County, and they're like, they think I'm lying to them. And I'm like, no, I'm not. I swear I'm not. So deaths by unnatural causes, and so we've just taken out the natural manner of death and put the other categories in here. And so we had 1 asphyxia, was positional asphyxia, 1 burns, and that was a house fire. We had 4 falls, which we'll dive into a little bit more, 3 motor vehicle accidents, and then again, no drug overdoses. Suicide by means, there weren't any. And so that's good. Obviously, suicide by age is something that we keep track of. We're obviously concerned about suicide at any age. We worry about, if there's young individuals and that sort of copycat scenario. So this is the total number of deaths that have occurred plus anyone's the injury occurred in the county. And so even if you were injured in the county and transferred somewhere else and died, we keep track of that so we don't lose those cases and that data. And so this is the suicide rate per capita, which there weren't any, but you can see how Houston County compares to the other counties. And then you have the red line, which is the average for Minnesota. Again, this is per 100,000, so relatively low population, so a few deaths can kind of shift that bar graph pretty dramatically. We'll just study this for a moment.
Yeah.
Yeah, seriously, knock on wood a lot. It's amazing. This is the homicide rate per capita. Olmsted County stands out, but a lot of these are individuals that are being transported from other places, like even Iowa and such. And so that kind of drives up that number. There are not that many homicides in Olmsted.
Do you know what Hennepin County's number is? Just curious.
I don't know off the top of my head. Monica can look it up for me while we're sitting here, though. But I will tell you this, I was explaining to somebody, like, so, I got here in 2011, and, I'd come from New Mexico, which has a lot of homicides. It's, like one of the leaders of that per capita in the United States. And people ask me if they should have a forensic pathology fellowship here in Minnesota, and I joked that I didn't really even think there was enough homicides in the state of Minnesota to have a forensic pathology fellowship, because you have to do a minimum of 50 plus during your fellowship year, and there weren't that many more, but like the number of like homicides, particularly in the cities and others, even sort of the northern counties, has really gone up a lot. So I was just looking at the data the other day to show this to someone, but I can't remember off the top of my head. But I mean, it would not surprise me if it's not up 30%, to more like 100, where it was more like 60 a year. I mean, so it's really kind of a staggering change in that. I mean, this is all previously, like if you had a gunshot wound fatality, would just be like a one gunshot wound. Now people have multiple gunshot wounds, and it used to be you would have one death. Now you have multiple fatalities at a scene. So it's just like a really, really different spot, where it's kind of closer to what big cities are like in other places in the country, whereas from my perspective, being from the outsider, but in this space, it was not like that previously. So. Accidental deaths by types. Again, I mentioned the asphyxia, which was a positional asphyxia, the falls, motor vehicle accidents, which I'll dive into more depth here in a moment. So there was one motorcycle accident, and it was they were struck by a passenger vehicle. There was one pedestrian, which was really awful. It was a child struck by a tractor. And then we had another sort of unusual device that was being used that they fell off of. This is the accidental deaths by year, and like basically where they occurred. And so we were just kind of keeping track of this, to provide law enforcement and state patrol and others as well, to see if there is a spot that seems to be particularly dangerous or what have you. But you can see that these are really just kind of literally all over the map. The types of vehicles, and it's interesting because this reflects what happens in different counties. Do you have more highways? Do you have more ATV and snowmobile trails? Or what are people doing as far as the sort of breadth? But again, you can see the different types of vehicles that have occurred. I've been involved in the fatalities. This is the per capita, and so this is, again, would include all deaths even that where the injury occurred in the county, but none of them were injured and transferred. So this is just the 3 motor vehicle related deaths. Accidental fall death related to falls by age group, and you can see that it's shifting to the population as it's getting older. Not that many years ago, it was just greater than 65. Now we're in the 95 plus category, and we're probably, which is good, going to have to add, probably eventually the 100 plus category. This is by location. So this is something we've started tracking because people are interested. Are people falling at home? Are people falling in care facilities? And what's the nature of the care facility? So there were 5 injuries, and 1 was transferred. But there was 2 that fell in the residence, 2 in assisted living, and 1 in another residence. So you probably expect it to decrease as you move towards the care facility, hopefully. Deaths related to poisoning or drugs, there weren't any, thankfully. There were 2 illegal drug overdoses last year, so to see that to go to 0 is nice, to say the least. accidental drug deaths by age group. So this is sort of interesting. I mean, it's good that you don't have bar graphs here in Houston County, but what we've seen is this is the drug overdose deaths. People sort of think of it as like you're 18, 20 something, but it's like 45 to 65, 70-year-olds dying of drug overdoses. So it's really shifted. Like in most of our counties, most of the deaths are in this like 45 to 65-year-old age range, believe it or not. This is the per capita. And so again, none in this county, but you can see a little bit of the variability across the counties. We have been seeing a trend downward in the drug overdoses from 2 years ago to last year. So there does seem to be a downward trend, and that's being reported nationally. We've had a few drug overdose epidemics. I mean, we had 5 in 1 week, 3 at one scene deaths in Rochester. So we'll see what this year turns out to. But hopefully that was just a blip, and the drug overdose deaths will continue to decline. Fentanyl, again, not applicable here, but fentanyl is still a major player. And this is where we're seeing these multiple fatalities at once. You know, people are taking a fentanyl derivative that's just so strong that as soon as each person takes it, they all basically collapse and die promptly thereafter. So no one's even conscious long enough to call 911 or try Narcan. And then you still see it mixed, like those fake like oxycodone pills that are really just fentanyl that people may not realize, or it's mixed with methamphetamine or cocaine. And, you know, if you're not an opioid user, you don't have that kind of tolerance for that. And methamphetamine is still around. It's never really gone away. Deaths by natural causes, heart disease and cancer are the leading causes of death, which is typical around the country. One that's interesting that we're kind of tracking are the liver-related deaths. This has been sort of a lagging consequences from the pandemic, where people increased their alcohol consumption, and people have seen in this increase in liver deaths years. And it's now years, so we're sort of keeping a tab on that. There has been an increase in the numbers. You can see from 2020 till 2024, we went from 1 to 5. And so maybe that's a reflection of that. I mean, those are low numbers, so it's a little bit of speculation. But it does seem that these are alcohol-related liver diseases. So, deaths by age group. Again, you want this shifted to the right because that means people are dying of their natural diseases. It's a very easy way to look at a population and see what's going on. If it's shifted to the right, it's natural deaths. If you see blips in the younger age group, you know they're dying of non-natural things, because that's not what the young individuals die of. So that's your homicides, your suicides, and your accidents. And so again, vast majority are shifted to the right with the older population.
Do you see more people in their 60s dying? I mean, is there, look, can you go back to that?
Yep. Well, I mean, there does seem to be this period where I think you essentially, and this, it usually comes up because it's more like the 85 to 94, you know, that period of time. And then you have this, you know, then, because these are just the total volume. And so you just have less of a population in that age group. And so that's reflecting the age. And I mean, and this is also good because we have seen there, for the first time a number of years ago, there was a decrease in the average life expectancy in the United States, which is because of the drug overdose problem, which is just terrifying that it's so many deaths. I mean, it's like 100,000 deaths. It's so many deaths that it's like shifting that number statistically for all the people that, you know, are living into their 80s and 90s. And then this is just a summary of our activities. We went to 119 investigations, signed 19 death certificates, 25 scenes. We attended to 10 autopsies, and 139 deaths were reported to us. So very stable year over year. So with that, I'll wrap up and be happy to answer any questions you all might have.
Really good
Any questions?
reporting. Thank you.
Yeah, very good report. We appreciate your services and
I appreciate it.
I worked with Mike and Bob for about 10 years.
Oh, really?
Appreciate this. Yes, before your time.
Oh,
The group. But one comment I would make is that a proximity of Houston County and a lot of the residents on the border to Wisconsin, we see deaths or incidents that might occur, but where the actual incident occurred is where the death isn't necessarily, it's in Wisconsin.
Yep.
But the accident occurred in Houston County.
yeah, so we're tracking that. So that's the blue data. So that's where we would capture those individuals that have been transferred. So we're ensuring that. And we have a good relationship with the Wisconsin medical examiners that if need be, and we do it regularly, if it's the injury occurred in one of our counties in Minnesota, we're happy to bring that individual back and do that for that continuity. So,
Kind of a unique situation in the state.
yes, and it's very different world on the other side of the river, I will say, which is kind of, I try to also explain that to individuals, like the contrast between, we do a lot for lacrosse, but like it's so different, like in lacrosse and that, which is not very far from here compared to what it's like over here. And so just an interesting juxtaposition, so.
Thank you.
did you have a number?
I did. So for 2024, there was 146, if I'm.
Okay,
Wow.
all right. Okay, thank you for
So
that.
I bet you that's gone up 50% in the
I'm
last
sure it
10
has,
years,
yeah.
which is kind of staggering. So,
We'll keep an eye out for a farm for you to buy down here sometime.
Keep you safe.
exactly, I gotta get my dad to get rid of his first, because he's getting up in his 80s, there's only so many farms. All right, thank you.
You bet, thank you. All right, we'll move on to the SEMCAC update. Bob Burns and Jennifer.
Thank you, sir. I got two of them.
Thank you.
Good morning.
Morning.
My name is Jen Hengel. I'm the Executive Director at SEMCAC, and this morning I'm joined by Jeff Wyant, our Senior Services Director, and our Board President, Mr. Bob Burns. So thank you for giving us a few minutes of your time to update you on some of SEMCAC's activities in Houston County. SEMCAC is Houston County's Community Action Agency. We're the designated community action agency for 7 counties in southeast Minnesota: Dodge, Fillmore, Freeborn, Houston, Mower, Steele, and Winona. Next year, we'll be celebrating our 60th anniversary of providing services for households with low incomes and vulnerable populations throughout southeast Minnesota. So I'm just going to give a brief update on a few of our activities, and then Jeff Wyant is also going to talk specifically about our senior services programs. So as you can see from the impact report that Bob handed out for us, our mission is to empower and advocate for people to enhance their self-sufficiency, and we've been focusing on poverty-related efforts throughout southeast Minnesota since our founding in 1966. We have locations here in Houston County at our outreach center and our food shelf here in Caledonia, 4 senior dining sites, senior nutrition sites, and 2 Head Start sites, partnerships with school districts, La Crescent Hoka School District and the Spring Grove School District here. So on the back side of the handout is some additional information. I'm going to cover what Jeff will not. So just our energy and housing programs. We have our energy assistance program, which is utility assistance for households with low incomes. And from that information, about 44% of households or of households served with energy assistance in Minnesota are senior citizens households. So the majority, and then another 20% are individuals with disabilities. So from that list of energy assistance household recipients, we can identify households with high energy usage, and we are then able to use our weatherization program to go into households to make those homes more energy efficient and reduce those energy bills long-term for those households. So you'll see there in Houston County, we had 10 households that were weatherized in our last fiscal year data. We also have housing rehab loans programs for income eligible households, so that households that can't get traditional bank loans are then can go through our housing rehab loan programs in order to make their homes more safe, accessible, those types of fixes for people, especially as people age and need more accessibility measures within their home. And if they can't afford to have those things done, then our housing rehab loan program can come in and help people. And those are typically low to no interest loans, or if the household stays in the home for a certain amount of time, the loan would be forgiven altogether. So we also have, I mentioned our Head Start sites in La Crescent and Spring Grove. Those are partnerships with our school districts. So those not only is it the preschool education for the children, but those families we make sure that those families are getting medical and dental care for their children and other access to resources and social services in the community. So it's really a whole family program to make sure that and to help that family rise out of poverty, because that program does target the 100% of the federal poverty level households. So it's very low income homes. And we have transportation here in Houston County. We have our bus service that is a dial-a-ride service available to anyone can use that bus service. We also have a volunteer driver program and a caravan program to get people to medical appointments. So those programs really focus on helping elderly or individuals with disabilities be able to get to medical appointments throughout the area. And lastly, I'll just mention our outreach and emergency services. So we have family homeless prevention programs, homeless prevention that can be mortgage or rent assistance for households that are at risk of losing their housing, or motel vouchers. And we also have our food shelf here that serves all of Houston County here in Caledonia, which Bob is an active volunteer. He and his wife both are. So serving over 300 households last year, and we're continuing to see the demand for food shelf services rise. And food security is one of the highest need areas that we're seeing in our community needs assessments. And so I'll just turn it over to Jeff, who is our Senior Services Director, including our Senior Nutrition Program, to talk a little bit more specifically about those programs.
Wonderful. Hello, everybody. My name is Jeff Wyant. I'm the Senior Services Director at SEMCAC. We operate the Title III congregate dining and home delivered meals programs across Southeast Minnesota, as well as the caregiver access and information programs for Houston, Fillmore, Steele, and Dodge counties. So just some quick stats to review across the top of your impact report there. We served 10,500 nutritious meals to 184 seniors in the congregate dining locations across the county. Congregate dining is a place for older adults to come and obviously congregate together, enjoy some fellowship, enjoy a nutritionally balanced meal, and take part in some volunteer opportunities, some activities, and some different things in their communities across those 4 locations that we have. We really like to focus on the congregate dining part of our program, as it is a really important piece to get individuals out of their homes, as social isolation can really lead to some detrimental health effects. So those congregate dining sites here in Houston County are very well attended and very successful. We have a great partner in town here with Elsie's, who allows us to have congregate dining in their restaurant there. For the second facet, we have our home delivered meals program, which we served a little over 23,000 meals to last year. And again, these are nutritionally balanced meals that are delivered to older adults' homes. Typically, these are folks that are homebound, they're unable to drive, they might have some other physical or mental disability that would prevent them from going to our congregate dining sites. These meals are equally as important, as it provides a daily wellness check for those folks. Sometimes that volunteer is the only person that they're going to see in a day, and it really, again, provides that check-in on that individual to make sure that they're doing okay. And then for the caregiver aspect, we served 71 seniors or caregivers in Houston County last year. That's getting assistance for application assistance, connection with resources, maybe it's a connection with public health, helping folks get dialed up for waivered services. There's a variety of different things that our caregiver advocate can help provide for older adults across Houston County. Something that's unique with that program is our advocates are on the road about 90% of the time. They go to a lot of folks' homes and help those people kind of where they're at, which is a really important resource for how rural some of the clients that we have are in Houston County. And our senior services goal, or our motto, is to empower older adults to stay living in their homes. We all know that older adults want to age with dignity in their own homes, as opposed to being put into, assisted livings or nursing homes or things like that. So all of these are home-based community services that allow older adults to stay in their homes. Just some other fun stats that I want to share from our client survey. 86% of our clients feel like the nutrition program allows them easier access to food, and it allows them to have more financial resources to spend on things like necessities, prescriptions, transportation. 91% of our clients feel like the meals allow them to stay healthier and have a better access to a better variety of foods. And then 89% feel like this program helps them maintain their independence. It's quite amazing how just one nutritious meal a day, 5 days a week, can help our clients stay independent in their home. I just want to finish up by sharing a couple of stories or a couple of client impact pieces that I have. So at one of our congregate dining sites, we have an older gentleman. His name is Gil. He was a very active part of our dining site before COVID. And obviously coming through COVID, we shut down all of our congregate dining sites. And coming out of COVID with the social isolationism and the lack of physical activity and things like that, Gil's health had declined quite a bit. So over the past few years of him returning to congregate dining, he's there every day. His health has drastically improved. He's much more mobile and is able to get onto the dining site, really kind of highlighting the importance of that congregate dining piece. And then this is a statement that we got in our surveys this year from a client here in rural Houston County. So this particular client in a winter a few years ago, they wound up snowed in, very sick, unable to plow. They didn't have a lot of food on hand. They happened to have a pamphlet from their doctor's office about the SEMCAC Meals on Wheels service. We were able to immediately get food out to them, and they were able to get signed up for the program. And they believe that this program is too valuable in the contribution to the better health of individuals who are involved. And they understand that the state and counties are already working on a shoestring budget, but further cuts to programs like home-based community services would only have an adverse effect on older adults. So that came through this year, which was great to hear. So we appreciate the support from Houston County in the past, and I guess let me know if you have any questions.
Given the situation that's occurring in Caledonia right now with the closing of our clinic and talking about your transportation and the rides given, do you expect an increase in calls for services to get to doctor's appointments, which would now either be transferred to either Spring Grove, Houston, or as far as La Crosse goes?
I think we're prepared for that. Yeah, our volunteer driver program already sees a high demand in calls. For that program in particular, our need is for volunteer drivers. That we've seen a decrease in people that are volunteering for that program. So it much depends on if we're able to get the volunteer drivers in order to get those rides. But we do have our public transit buses that can provide rides. Right now, they're the Caledonia bus services Spring Grove and Houston area, as well as does the Rushford bus can get over to Houston. But that bus is available to dial a ride service. So we typically ask people to call 24 hours in advance for that service. But in that bus can get people as far as La Crescent to connect with that public transit system that would then get people into La Crosse.
So you don't go into La Crosse?
That the public transit bus service cannot cross state lines. It's
Okay.
It's a Minnesota Department of Transportation rule. So
Does it
So
run
there
it?
is a connection there.
there's a connection in La Crescent with the bus service there.
So you run every day, you think? Pretty close? Or?
The bus service? Yep, the bus service is Monday through Friday. And it's not necessarily designated routes unless we
Oh,
have
I
like
know.
some different contracts. Our bus service is more dial a ride, so it can be,
Right.
curb to curb service. Yep.
How many buses do you have?
Here in Houston County, we have the one bus in Caledonia. Overall, throughout the 5 counties that program serves, we have about 17 buses. Yep.
You have a fairly new building in Casson, isn't it?
Correct, yep. But we also lease garage spaces throughout the area too, as we need to, but yep. I just wanted to reiterate Jeff's comment about your support for SEMCAC. We thank you very much. We did include in your the handout too the letter that was sent to the county. We're requesting the same support as we have in past years, and we just appreciate the support that you have given us in our programs. we really need to be able to show that local support for many of our grants that require matches or require non-federal share and those types of things. So the support from Houston County has an impact, and we appreciate that.
Great service. I always hear very positive things from
So these
clients
numbers right
about
here are the same
SimCat.
as what was last year.
Very good service.
That's what she said, yeah. It's the same as last year,
Our
right?
request is the same as what we requested for
Not the
2025.
same as what we were given, it's the same as.
Is what
the
we
request.
Well,
requested.
that was my next question.
Yep,
What's in the budget, Kara?
for the,
The same as what we've given, which is the 2,000, 1,500.
We have with ARPA funding and CARES money, yep. So, like the money that you did get from CARES and ARPA, I'm sure you utilized it. I suppose you weren't able to retain that or save some of that, or you just utilized it?
yes, we utilized what we were given. Yep.
Similar to the county, you use it or lose it. Yeah. You had a
Yeah.
time frame and you had to spend it within that time frame.
And that funding has changed, right?
It's gone,
Yeah, changed and,
it's gone.
yeah.
Okay, all right, well, thank you for what you guys do, appreciate it.
Thank you.
Thank you.
Yep.
Thank you for your time.
Thanks.
All right, we'll move on to consent agenda. We have 2 items on the consent agenda. Any questions on that, or if not, is there a motion to approve?
Make a motion to approve.
Second.
I mean, the second one was updated at that meeting,
Yeah, I'm not sure why that's on there again.
but anyway.
Whatever, it's fine. We'll reiterate it, so.
Is it the retirement date?
Yeah, it was
It's the 30th.
October 31st instead of November 1st.
Okay. So it's just updating.
At that meeting,
Oh, okay. Okay. Well, we're doing it again.
So
anyway, it's covered now.
we got a second, right?
Greg?
Greg?
Greg.
All right. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right, we'll move on to action items. Action number 1, consider approving the cannabis retail registration for Adios LLC for cannabis retail site located in La Crescent Township, pending staff review. Amelia?
Morning, Commissioners. Holly is out of training today, so I am here to walk you through this. This is our first retail registration for a cannabis business. This came in right prior to the deadline on Thursday, so we wanted to get it on the agenda, but that's why it stated pending staff review. As you can see, on the application, the applicant is applying for a cannabis retailer registration. The cannabis retailer is a permitted use within the highway business district, and so there are no additional permitting requirements as far as interim use or anything along those lines. They have provided us with all the appropriate documentation, and Polly did say that they are current on their taxes. And so we do not find anything that should hold up this application at all.
So the hours are standard hours that we allow in ordinance?
Yes, the hours that are referenced in the application would match what we've permitted in our ordinance. And so by checking that, they're agreeing to follow what we've set forward for that requirement.
You kind of briefed us a little bit at our department head meeting. Do you want to maybe just brief the rest of them on that the other application was pulled and null void now?
Yes, so this is replacing there's been one, it came to board a while ago, but then got held up for other reasons. And that was under Canalede MN. So that has been formally withdrawn, and then this is replacing that. That one was for a cannabis micro business, which had additional requirements as far as an interim use. Like I said, this one is just for a cannabis retailer license, and so it does not have those additional permitting requirements.
They totally dropped that portion.
Yep.
But it's the same individual?
This is a different individual. This is Jason Gildia. There is a lease and everything establishing that there is a connection and an intent to operate the business there, an operating agreement, and let's see. But it is a different individual. The license is under a different individual.
So explain the difference between the two permits, like the one that they reneged or pulled. What would they could sell with that one? Those stuff?
So I think the micro business has some other options for them, like they can actually cultivate there as well and do some manufacturing, I believe. Whereas a retailer license, they're strictly only retail at that site. Kind of based on what some of the other applications we've seen come through, I think the micro business license was more what people had sought. I think there was a cost perspective to that as well. And so most of them were coming through with micro business either for like just the cultivation side of things, or like this site did only intend to do retail. They weren't going to do, nor could they do any cultivation at that location. But that also does have the interim use requirement then.
So the retailer would be, he's buying the marijuana from a grower and then just selling it?
They're just selling the product, the end product, not doing any of the grow part of it.
Or let's have it shipped in and they break it down and sell it the way they want, correct?
Yeah.
Okay, thank you.
Any other questions?
No way we can stop the retail, is there? Automatic?
Well, grounds do, though.
Like public safety, that don't matter there with the highway the way it is? That's all just going, let's go, huh?
And they do still have to meet state requirements before they can open their doors. This will allow them to seek their permits to build, or they have a change of use permit in, but they want to do some build out on the structure and modify that. And then they'll have to get OCM approval. So it's still pending them actually getting that approval on the final inspection of the structure. And I don't know that this would eliminate any of the MnDOT requirements that we had discussed, just because that was somewhat independent of the interim use process.
But they'll still be coming back to you for a permit to do any modifications to the building, correct?
That has been sitting for a while, yes. So
Okay.
pending approval of this today, I would issue that. We also have the zoning compliance that the county has to sign off on. But that would, I think we have everything together. Once this was approved, I would issue that as well.
Mm-hmm.
So this is our first and only true Houston County registration or application?
At this point,
So
yeah.
far? Yeah.
First one.
I'd motion that do you want a motion to approve the action?
That's what the action item requires, consider approving.
Okay, I'll make a motion to approve.
Motion's been made. Approval, is there a second? Is there a second? Is there a second?
Yeah, I'll second it.
All right. Any further discussion?
There's no way we can stop it anyhow.
No, there isn't, but
But
my only concern is that there's already 3 in La Crescent, city of La Crescent, and there's gonna be 2 on that pike in the city. part of La
Few
Crescent.
Grocery stores too, Eric.
Yeah,
Can't stop it.
yeah, you can compare it to grocery stores if you want, I guess, but cars, right? Yep, more the better.
Bars.
Liquor stores.
I just look at it as this registration, at this point, application looks complete. And if your team has reviewed it and moved it forward, then I don't see a reason not to approve this at this point and see how the process goes with.
There might be a hiccup in the process that might stop them too, who knows? But they can't move forward until we give them this permission, correct?
Correct.
It is downscaled from what the initial use was gonna be there. That
Yeah.
might have been a plan on their part too, but.
It's allowed by
it
state
is.
law, so.
It is, it's right. It's allowed by state law. They made it legal and our only role is for what our zoning and ordinance allows, so.
This, that one by Quick Trip, I don't think it's gonna be there much longer.
It's in the city limits.
Yeah, that's not one of the three.
The one that's in Quick Trip by La Crescent down there.
They haven't done, that one's not in it, not yet.
I think Quick Trip bought Cindy Buki's building, so I think that's trouble there.
Okay, any other further discussion? If not, all those in favor signify by saying aye.
Aye.
I,
Opposed, same sign, aye. And I voted no because of the fact there's already 3 in La Crescent and it's a public health and safety issue. Number 2, consider reviewing and approving payments. Anybody's chance to look at those? Is there any questions on those? Thank you, Amelia.
Thanks.
reviewed the payments. They appeared to be in order. I'd make a motion to approve.
Is there a second?
Second.
Now, this is for both, right? Commissioner warrants and the auditor warrants?
Yes.
So like on the forensic, $48,000 for computer forensics, is that the grant? Okay, yep. Okay, all those in favor signify, we had a motion, right? Second.
And a second.
Yep, yep. All those in favor signify by saying aye.
Aye.
Opposed, same sign. All right. Number 3, consider discussing a budget levy.
Okay, so, we've gone through a couple different times, our original request and then had to make adjustments. And the amount needed now to balance the budget after making the changes that are listed on the back. There were just some minor revenue and expenditure changes for $9,897. We actually removed also the historic courthouse capital improvements, which includes stairwell improvements, a couple other things. The Woodland Building capital improvement and the Justice Center capital improvement, $165,000, which will come out of the fund balance that we have still reserved from the FCIT insurance. Starting in 2012. We have around $400,000.
Okay.
So we'll use that. It was decided to use $199,873 of fund balance for road and bridge and $100,000 in fund balance for cleaning. So that brings the levy need in order to actually balance the budget at 7.905%. The lower portion of the middle column, if the board adopted a 6% levy increase, there would be a need to use $308,368 of general fund balance. If they decided to go with the 7%, we would use $146,522 of general fund balance. We did discuss it at the finance committee meeting this morning, and based on our need to have 50% of our levy and the capital improvement funds that are in there, the amount that's still in there for the jail, old jail insurance refund. After that, we still have approximately $600,000 that's unassigned. So it would be up to the board to decide whether they wanted to use a portion of that.
This is our preliminary levy, which will go on our tax statements. TNT notices, yep.
And, this is the part where come December, you can't increase
Right.
the amount.
And I just want to reiterate for the sheriff's contract, we still included the Spring Grove contract for the next year. Yep.
We received a notification.
From the administrator to keep it in there.
Right. Because we were at the meeting where they did vote to approve it.
Talk of wanting to
Other
backpedal on
happenings
that.
the rest of the week, and maybe they wouldn't, but then Janice said she was leaving it in there because that's what they voted on.
Mm-hmm.
But it's an offsetting, it doesn't affect our levy.
No.
It only affects our budget number.
Mm-hmm.
Whether it's in there or not, it's not affecting our levy ask.
Well, if it's not in there, that would affect our levy. If we didn't have a contract?
We didn't have a contract, but right now, the 203 department, the revenues and
Right. Right.
for us, it doesn't affect our levy.
No, I understand that. But if at the end of the year, they decide not to do the contract,
Our revenues would decrease by the $400,000 and our expenditures would decrease by the $400,000. So it still wouldn't affect the.
Lay off the deputies.
But when you lay the deputies off,
well, that'd be a conversation we'd have to have then, but.
yeah, I mean, that's till December.
Another question I was gonna ask, but. That's using the fund balance from Public Health and Human Services of 100,000 and the Road and Bridge of 199,000.
Wrong with 7.5
7. 4-7.
or 7. For preliminary.
Can't go up.
Can't go up.
Can't go up, can only go down.
Let's do 7.5 then. Go down,
What's that, 7905
9 something.
right now?
You'd have to look at a little bit of fund balance and hopefully some areas will come under, some areas. Highway ends up a little bit
Still ain't really sat down with the sheriff yet either, so.
Ryan was here.
I mean, not for his budget. We need to go look at that a little more, don't we?
No, he was here for that.
We had a sheriff's office discussion a couple weeks ago. I don't know.
What's that come out to? So the ask on that would be 1,336,622, correct?
What's that?
Were you?
The levy would be 1,336,622.
The net.
That-
You're talking about the net.
Increase over 2025.
Right. The total levy will be 16,180,000
Yeah, I saw that.
or
It's
16.
7.905, I based off of that number right there.
Well, actually, no, it's
Total.
17 million, right?
17,464.
Yeah.
Then you subtract your CPA from there.
At the 7%.
Because the net is higher,
Yeah, 57,000. So did we ever get I forgot to, should have done this a while ago, but a number from Luke, the assessor's office on new construction capacity and our tax capacity?
Houston County, 8,000.
Talked about that though. You mentioned it. I just don't think we got it.
I think last year was like a million, over a million maybe or something, but
Carol, how many households are in Houston County? 9,000.
So are you thinking that could lower it though? Because we could still
well, that
have an
would just,
opportunity to.
it would just increase our, it just, yeah. Increase.
as much of an increase for
Okay,
the ones who were
Got
here
it.
last year.
More new construction, that just increases your tax capacity, which would absorb some of the increase a little.
so if we set it at the 7%, we can actually look at that afterwards and see if we could adjust it.
Can't go up.
It can't go up, that's
Can't
it.
go up.
But I'm just saying that would,
You can go down, but you can't go up.
if that's the number.
So I guess we gotta decide whether, you know. Right here, it's at 7.905 to get a 0. You guys thinking? I mean, Kurt and Cindy have been on the finance, listening to the numbers.
Recommendation
talked
is a
about-
7?
I'm comfortable with, right now, because we can go down, I am comfortable with the 7.95
Yeah,
that Carol put together.
Makes sense
Nicely
to
done,
me.
by the way.
Makes sense to me because then we would not go up. That would be the highest. Right.
Leave it where, right now, we have preliminary numbers, and we will go from there as we move forward. Far cry better than 12.98%.
Be nice to see
And that's
that.
not too far out of line with
The
others.
data you're talking about too, with the housing, new construction.
And we can get that for the final.
I'll make a motion to set the levy at 7,905 preliminarily.
Motion's been made. Is there a second?
Second.
Any further discussion?
I guess just keep looking at how we can bring it down more.
Yeah.
That's what I would strongly encourage, that we need to keep looking.
We were
Always do.
7% last year. Correct. Carol?
You know, we gotta keep in mind that our wages have gone up quite a bit. We had a 6.5 for 2025, correct? It'll be 3.5 next year.
6.5 to match that.
From the finance
We already
committee
paid it with
perspective and being fairly new on the board, I think, everybody does a pretty good job of keeping these expenditures in check. And, it's just a tough year again. So that's why I support that at that level. Question, when you normally do this, when you were at 7% last year, did it come down from, was it proposed like a year ago higher, or how did that work?
Higher, just like,
Okay. And it came down to
I
7?
don't think we did come down, did we?
Or was it the same?
I think we set it at 7.5. Did we come down to 7 maybe?
No, we didn't, but I think she's originally saying higher than 7.5.
Yep,
Oh,
yep. She's reading my
That's-
mind. Mhm. That's my question.
Are you still in any more discussion phase?
waiting for Cindy's answer here. Yeah.
Sorry. I'm just trying to keep you on a
So
schedule.
last year, it was actually about the same.
Okay.
The original need
Mhm.
was 11.8.
Oh, okay. Okay, about the same then. I'm just curious how that works. So we can keep looking and get it down there if possible. That's all I had.
All right, well, this is our preliminary, so we still got room and time to whittle on it, so there's no other discussion. Is there we'll just have a vote. All those in favor signify by saying aye.
Aye.
Opposed, same sign.
Okay, so the proposed budget based on submitted revenues and expenditures that include the tax levy and fund balance usage. I guess on the sheet that was in the packet, it has changed a little bit. So I can print this really quick, but
The resolution.
so the general fund, revenues and expenditures are at 14,716,154. Road and bridge at 11,246,726. Public health and human services, 8,379. Services at 1607.
So is there a motion to approve the resolution with those changes in the numbers for the proposed budget? Is
So moved.
there a second?
Second.
Motion's been made and seconded. Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed, same sign. Number 5, consider adopting resolution 2534, adopting the 2026 proposed budget.
Motion to approve.
Is that the same? Okay, what was this other one?
Proposed levy, and we already
Okay.
voted on that one.
Oh, okay.
All right.
So it's double.
We're doing it again?
We had a discussion, then we went, okay, my bad. So, all right,
So moved.
we're done.
That's it.
Taken care of.
We're done. Discussion items. Carol, you have anything, or are you gonna?
I'm just grabbing.
Okay,
these.
well, I'll just move on with mine now. I don't have a lot. I got a planning commission meeting Wednesday night. Next week, we have an extension meeting, Greg, October 2nd, I believe.
Thursday night, right?
Hmm?
Thursday night,
Yep,
out there.
yep.
Yeah, we have the
Thursday night, we got township.
Township Association.
Township Association meeting.
Right, that's another one I was gonna bring up.
That's on Thursday night.
Thursday night, township officers, it's a luncheon, so,
It's supper, right?
Annual meeting.
Right.
Joey. Yep, their annual meeting.
So this replaces what we have in our packet. This is the update, okay.
So,
Go ahead.
what was the lunch?
For the township officers,
Oh,
The
okay.
dinner,
Thursday night.
Thursday night.
Late lunch.
Okay.
Yep.
We'll be reviewing the insurance proposals that we received.
Oh, so that was done? And you've gotten some proposals back?
Right, so we have the SSC, which we're a part of right now, and that showed the 8.5%. So that's why we increased. You know, even if these higher, we have the 8.5.
Mm-hmm.
So we'll be removing
Okay,
see where
all right.
meeting yesterday and
Yep, new ruling.
Was I supposed to be at that one?
property. We have, it used to be 10 acres for green acres, with green acres credit, and now we have 1 acre. We can get a green acres credit, it could be $20,000 of ag product. Ag product has been kind of redefined as including flowers.
Cannabis flower.
Cannabis. Yeah, we talked about that.
Things,
Mhm.
so.
Thing you want to grow.
Yeah, you know, so, and in that, I think people forget that if this person is then given an ag classification, it lowers their taxable market value, which lowers their net tax capacity, so the amount that they're not going to pay gets spread out to the people who
Yeah.
have a change.
Mm-hmm. It's gonna spread out to the residential and commercial. And it did that for 2025 too, because the cap was increased to 3.6 million or 3.5 million, something like that, where it used to be, was at one time 1.7.
Oh, wow. Yeah.
Yeah.
How that works. Yeah, it sounds like a benefit, but not to all.
Well, the benefit to the farmers
Yeah.
is not so much for the residential.
Yes.
But the farmers are, basically getting ag credit.
Mm-hmm.
At any size farm is getting the maximum value of the credit that they
I don't know.
So Luke was bringing this up?
Yeah.
Yep, all the different, there's like 5 different changes, I believe.
Yeah, he listed a few that we'll have to know more about probably from him. Because they were recent.
It's from new legislation, yep. Okay. Commissioner Wright?
Oh, let's see. One thing I don't know if I've mentioned yet here is we did have the EDA group were offered a tour of the snowpack facility. So I did that earlier this month, and it's amazing. I was very impressed, and I'll eat fresh cut beans or those fresh frozen beans the rest of my life. But yeah, their process is really amazing. So it was good to see their facility. And then we were there actually to do the groundbreaking for their new facility that they are putting behind their location and replacing that. And it's moving along. So that was a very good experience. I had an event for Hiawatha Valley Mental Health called Bringing Light into Darkness, focusing on the suicide in Winona. That was a very good event, very well attended. They had a band and all of that for entertainment, but it was a very good attendance at that meeting as well from the community. EDA meeting, I've had 2 SHAC meetings in the last couple of weeks, and the Southeast Minnesota Tourism Advisory Group. Let's see, so highlights, I think we've had I had workforce development meeting, talk a little bit more about that. A lot of these groups and the meetings that I have attended, obviously, it's budget time of year, so a lot of concerns and discussion on what their projections will be and also their ask for the county. Finance meeting, as Carol mentioned this morning, And then this afternoon, I have a transportation meeting in La Crescent to talk about like routes to school, more or less. So if you want to know more about that, I can fill you in later. It's more of a community input session on that, and I have Selco this evening, so more interest in what's happening with the libraries.
You just reminded me what my other question was. Selco, what did we put in the budget for that? So it was 197,000 times the 2%, so what is? So was that relayed to them? Or are you gonna do, that's what you're going to do, Cindy? Or
About $4,000.
Yeah, they haven't asked yet because it's
about
still
3,900 for
preliminarily.
you? So that'll put them at like 201 or something like that?
Right. What was the increase on that, 2%?
Yes.
Yeah, around $4,000. And so are we doing, Carol?
Okay.
But they're asking for a 3-year contract, right? So did we do a 2% for each year or just for this first year?
Renegotiate every year.
Redo it every year, yeah. It was the major request was for the first year. Right.
They were asking 30,000.
But more the first year, or the amount the first year, right, and then none. Yeah, yeah, I'm not planning on discussing that at the meeting, but I can let you know what I am interested in is what other counties are doing to support that as well, so.
Well, it's
And cities.
worth noting that it's way above what we're required to by state.
Absolutely, yeah.
Okay, anything else?
No.
Okay. Commissioner Zender.
Yeah, meeting coming up, Rochester next month, head finance. Today, we haven't, got the rest of our preliminary number stuff that we wanted to have on, that we've sat down and talked about on the Able building. Thing Thursday night, which I expect all of you to attend.
I plan on being there.
I've never been there, so I know what it's about.
Are you cooking?
I am, yeah,
Rosie's cooking, I believe.
That's good,
I believe she is.
perfect.
Anyone doesn't want their dessert?
She has great, she has great food.
It is good,
Love her food.
really good.
I have nothing else.
Commissioner Schultz.
Oh, so we had the solid waste quarterly meeting, me and Amelia were at. No real big changes, kind of looking at some of the recycling stuff they talked about. Some of the counties that have been doing the, like we do the collections and maybe trying to maybe work something with them on instead of it just going away to the, to them guys just paying, of trying to do their own, where they recycle it into their little shed thing over there, and exploring that a little bit. Otherwise, everything's on track there. We had department head yesterday, we pretty much covered that. Looks like we have a personnel follow-up meeting on Friday. Thursday? Friday. Thursday or Friday, I'll have to check my
It's
calendar.
Thursday, but I'm at 9 o'clock, right? Thursday at 9?
Thursday at 9. Okay, I might have a conflict on that one. And then we got the meeting Thursday night.
Okay. Commissioner Myrie.
I guess township supper on Thursday night and personnel Thursday morning. Not much else going on that I know of right offhand.
Okay.
Can I mention, anybody have any input on the US gravel bike race from last weekend?
I was just gonna say, Brian just sent you.
Yeah.
Yeah, I was, been reading it.
And also, County Engineer Brian had mentioned too that he, everything like signage wise and things seem to go okay. My view of it, either not participating, God forbid, but seeing what was happening in that general area was it was a lot for the first few hours, and I only saw, a certain portion. I actually was driving from La Crescent to through Caledonia and Spring Grove that day, so it was, there was more volunteers than I expected, but it sounds like, there might have been some concerns with flagging areas. They were controlling traffic in town. But there really wasn't any report out at the city council meeting for La Crescent last night either, but there's some very good videos out there. If you want me, I can share those of the event. And also a lot of coverage from the media on that event. There was a pretty good surge of people in the area, but I'm sure that they won't necessarily have the economic facts and figures necessarily right away on the impact of that, but.
They were projecting 1.2 million.
Yeah, but where is that?
Yeah.
And La Crosse and La Crescent, I don't know, but it's at least, it was, they got through it anyway, so, yeah, I didn't hear anything, I was just
I didn't
curious.
hear any major incidents.
No, I think there was a,
We have here,
I think there was a,
several bicyclers received scrapes and bruises from sliding out. One person had a broken collarbone,
Yeah.
although that person
Was a motorcycle.
could possibly have been a motorcycle official.
yeah, I didn't hear that part, I knew it was someone, but, right.
Sounds like the rain helped.
Yep,
Gravel roads.
it wasn't dusty.
Right, that's what they said, they preferred that there be some rain on the roads, so. A lot of,
Assume this next paragraph regarding the traffic plan will be
yeah.
Jeez.
Lessons learned on, what to do, and the other thing is, I know I mentioned with the city council officials that, the communication is definitely appreciated. So I think they learned, to communicate sooner on that as well, and, understand, but also, just the, a lot of social media, and also in the media, it was evident that, a lot of people enjoyed being in the area. So I think that was a good goal that they had to showcase the southeast Minnesota county areas. Yeah, exactly. Or live.
I didn't hear too many complaints. All I heard that they were all over the road, but you're gonna expect that. That's gonna happen when it's.
Kind of figured that would happen.
Yeah.
I think that there was also,
Only one day.
more of a issues and incidents prior to with people training and checking out the route, because it wasn't as structured. So. It
So
happened.
Blue Gonstead also sent an email.
Oh,
Okay. Just to shift gears here a little bit on this email I forwarded to you guys about the Rural Counties Association. What do you, off the top of your head, Carol, do you know how much our dues for AMC are? 11,000?
I haven't gotten a final number.
Okay.
So, oh, no.
I'll email this gentleman back and ask what the dues would be if we were to be interested in joining that.
The Minnesota Rural.
Yep.
it looks like it's $2,300 for our county, right?
Yes, in size wise.
Okay, that's in the, oh yeah,
It's right there.
I see it.
What is that? Can we do a comparison or? would we be involved in one and not the other, or add
Oh, no,
this
we'd
one?
still be a part of AMC, and this would be just an extra.
Be nice to know what they offer. I see this attachment here, but I don't know much about them.
Ridiculous.
Really good to know.
We'll get some more information on that and have another discussion about that down the road. I think it'd be something worth considering.
Okay.
We could do that. I think he's been here before, a long time ago. It's been a few years ago, but I know I was here when,
This now.
Asking again, maybe. Yeah, I'd be
we could,
curious.
we could request them to come and give a presentation.
Yeah, what they do. And also maybe ask if they have a list of other counties, or we know the counties that are involved, what the benefit that they see in it, asking their opinion on it. Kind of reviewing, the whole organization and seeing if it's worth it. But I like the idea of any information that we can gather, especially as we look at our budgeting and talk about cost efficiencies, and see what others are doing to compare what we're working on here as well. Or staffing models, everything. I think it would be good to see.
So I guess I'm getting the impression that these last two meetings.
Oh. And that would be good. That would be good. Yeah.
Alexandria and Bloomington.
What's working for us?
Yeah, looks like they're inviting, right?
Well, see, that's the one I go, this is during the AMC conference, and I do go to that on Sunday night. I have gone to their thing, yep.
Good to see what else they do during the year then.
They just have more of a rural perspective, so they can, when
Yeah.
they talk to legislatures and give the rural perspective to the counties versus where, metro areas.
Are they a lobbying group? Do we know?
They lobby for Minnesota rural counties.
Okay. I just didn't know if that was an
Solid
effective,
effort on your part right there.
effective group or not with that. Capitol Hill Associates team, assuming. They're connected somehow.
Cool.
All right, anything else? Any closing public comment? Is there a motion to adjourn?
So moved.
Second.
All those in favor signify by saying aye.
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 Opposed, same sign. Thank you.